So the next topic we're going to review is focused ultrasound. So if that is the right option, and that is with Dr. Li-Ming Q. So Dr. Li-Ming Q completed a residency in neurological surgery at the National Neuroscience Institute in Singapore and attained specialty accreditation. He then underwent a 2-year postgraduate fellowship training in stereotactic and functional neurosurgery at the University of Pennsylvania. Dr. Q's clinical expertise includes deep brain stimulation and focused ultrasound treatment for movement disorders and neuromodulatory management of chronic pain disorders.
Thank you, Gabby, for the introduction. I'm going to put up my slides. Do you see my slides? Can you hear me?
Looks great, Li-Ming. Just make sure to have clicked on the sound option for your videos.
Yeah. All right, good. So I'm going to talk about focused ultrasound for essential tremor and is it right for you? So some of the considerations that we make when we see patients in the clinic to decide whether, good candidates for focused ultrasound. So what is focused ultrasound exactly? It is a novel technology that has been developed in the recent years. And unlike deep brain stimulation, which Dr. Cahigas mentioned earlier, it is one of what we call an ablative technology. What that means is that we use this technology to heat up the tissue to destroy some of the cells in the brain where we target precisely to stop tremor. So what it does is to harness the power of sound waves, what we call acoustic energy. And how it works is by using more than 1,000 ultrasound beams and converging them all together. And at that point where ultrasound beams comes together, it heats up the tissue right at that point. You can see here in this diagram, only when the beams come together does a temperature temperature increase and heats up the tissue. So throughout the path of each of one of these 1,024 beams, nothing happens in that path. And this technology, compared to other ablative technology that was developed before, it has advantages, mainly because it's more precise. We can make smaller lesions. There has been proven improved safety profile. We are able to use real-time technology with this, real-time imaging technology with this focused ultrasound to make sure we are treating in the right spot. We can monitor patients because they are awake in this procedure, as I will show you in a short while. There are no radiation side effects compared to radiation such as a gamma knife. It's an outpatient procedure, meaning you come in for the treatment, you go home on the same day. There's no implant, unlike DBS. I will discuss some of the factors to consider, however, because not every patient is suitable for focused ultrasound. And the targets we use for focused ultrasound is similar to deep brain stimulation that Dr. Cahigas talked about earlier, especially for essential tremor patients. So this is a short video of how focused ultrasound looks like. So everything is done in the MRI machine. You can see here, there's a head frame, the same one that we use for deep brain stimulation and focused ultrasound. We use imaging technology to help us with the targeting. So we plan the target beforehand and we instruct the machine to direct the beams at where we had planned the target. There's no radiation, as we mentioned. So because it's a new technology, we have had to show that this focused ultrasound technology is better than what we had before. So there was a lot of research that went into developing this technology. And since 2016, it has been approved for the treatment of tremor, first with essential tremor and subsequently for Parkinson's disease-related tremors and movement disorders. So you can see here in 2016, it was approved for treating one side symptoms for essential tremor. And very recently in 2022, it's now approved for second side treatment, meaning patients who had treatment for one side, they can now come back to treat the other side. However, I would say that you have to wait 9 months between the two treatments. And the reason for that is because historically, it's been shown that treating both sides at the same time is associated with more side effects. So when this was developed, research has been done with it being staged, and that has been shown that to have a more safer profile. So these are the studies that I mentioned before that have been done before focused ultrasound was approved as a treatment. So you can see here at baseline, patient has very high tremor ratings, and after treatment at 1 year, 2 years, and 3 years, there have been sustained improvement in tremor. The latest study showed at 5-month follow-up, there is still sustained improvement in tremor. So you can see here, if I direct your attention to the blue bar chart. So this is at baseline. So patients has a lot of tremor, and so this is 1 year, 2 year, 3 year, and up to 5 year. There is significant improvement in tremor. However, if you look closely, some patients did have some return of tremor, but that's minimal. So in this study at 5 years, there are reports of side effects, which I'll come into in a short while as well. So patients have reported side effects. The most common that we see are imbalance in gait, speech difficulty, and things like tingling and numbness. And the reason for that is because, as I mentioned, this is an ablative therapy, which means we destroy the tremor zone as precisely as possible. However, in the thalamus where we do the treatment, it's very close to other important cells. And these are the cells that are involved in gait balance, sensation in the hands, and speech. So especially immediately after treatment, in the first week or so, there's swelling, and that's when patients start experiencing some of these side effects. Most of the time, I would say more than 90% of the time, these are transient. As the swelling gets better, the side effects tend to go away. Although I would say that a small percentage of patients tend to have long-term side effects. And these are the patients we are usually more careful of, and we screen thoroughly before we recommend a focused ultrasound procedure. This is a very recent publication of a bilateral thalamotomy. Again, there's been sustained improvement in tremor, minimal side effects that are long-term. So because of this new technology that's been around since 2016, I'm sure some of you have heard that of this more being mentioned more and more. And we as providers and physicians who provide this treatment, we've seen a growth and a lot of interest in this treatment because it's non-invasive, meaning we don't need to make an incision. And there's a lot of interest in this, and we've seen a lot of growth and patients asking for it. So what should you expect and what happens during the procedure? So first of all, one thing to mention, if you're not aware, is that even though this is a non-invasive procedure, patients do need to shave all the hair. And the reason for that is because this harnesses the ultrasound waves. And if you recall high school physics, ultrasound doesn't work very well with air. And with hair, it traps some air, and that may deviate the beam of the ultrasound, and that makes things the technology inaccurate, and we don't want that. So in order to have focused ultrasound treatment, the patient does have to shave all the hair, and that's one consideration for patients. Some patients do not like that. Again, we do all the planning beforehand. We do a high quality MRI and CAT scan before the procedure, and we do all the planning and calculation beforehand. During the procedure, we'll get you to do the spirals that we do in the clinic, and we'll do that several times to make sure that the treatment is effective and there are no side effects. So this is a video.
During the treatment, you will lay down on the treatment bed inside the MRI scanner. The medical team will be in the control room, and you will be conscious and able to communicate with them. Your head will be positioned in the focused ultrasound helmet, which is filled with water, and you will have a blanket to keep you warm. You will be given a stop sonication button if for any reason you want to stop the procedure. MR images are taken to plan the treatment. Your physician will first apply light doses of ultrasound energy to identify the right spot in your brain for treatment. Then, full intensity ultrasound energy will be applied. The treatment bed will move in and out of the MRI. After each application of ultrasound energy, you will be asked to do tasks such as drawing spirals. This is so the physician can evaluate the improvement of your tremor and any potential side effects. During the treatment,
So the benefits of focused ultrasound, like mentioned, you can see immediate and durable tremor improvement on the day of procedure. You can see immediate improvement. Most of the patients go home the same day. There is little to no risk of infection, unlike deep brain stimulation, because we don't make any incision. The only thing is we put pins. So there are small pin sites when you go home on the same day. There are no implants, no anesthesia. We keep you awake so that you can communicate with us, whether you have side effects, and we can assess the tremor throughout the treatment. During the treatment, however, some patients do have discomfort, and these are things like pain. Some patients complain of dizziness or sensation of nausea. Again, you're completely awake during the procedure, so you can tell us if you have any of this sensation, and we can let our anesthesiologist know, and we can give you medication during the treatment. Now, depending on the patient's skull properties, for some patients, we need to give higher dose of energy. For these patients, sometimes they have more scalp swelling or discomfort after procedure. And again, the swelling tend to happen, 1 or 2 days later. It may not be seen on the day of procedure. So we have some patients calling up 1 or 2 days later, complaining of swelling or the eyes not being able to open. We do see that sometimes, so that's not something to be extremely concerned about. So again, this is an example of a patient pre and post focused ultrasound treatment. We often see dramatic improvement in the spirals, and they can immediately start using their hand. And a lot of times, we are told by patients that, they haven't been able to do this for a long, long time. So they do see a dramatic improvement in the tremor. It is also now approved for Parkinson's disease, both for tremor as well as other symptoms, motor symptoms of Parkinson's disease. So who is eligible for this treatment? For essential tremor, the criteria is that you have to be an adult, age above 22 years old with a confirmed diagnosis of essential tremor. You have to have tried medical treatments before, mentioned by Dr. Feldman earlier. For second site treatment, as mentioned, we have to wait for 9 months between your first treatment and second treatment. And for both essential tremor and Parkinson's disease, some of the other criteria we look out for is the patient should not have contraindication to MRI, because the whole treatment is done within the MRI environment. The patient should be able to lie flat in the MRI machine for about 2 hours altogether. Some patients are unable to do that, and because of the positioning and the need to be with the head pin, we have had patients not able to do that. So that's one of the things to consider as well, whether you're suitable for this treatment. And of course, the ability to communicate with us during the treatment and press the sonication button if needed, as you saw earlier. So again, what to expect. So if you are considering whether you're suitable for this treatment, you should ask your neurologist or, book an appointment to see us, and we can talk to you about, what to expect and discuss all the nuances of whether you're a candidate or not. So pre-surgery, again, we order a high-quality MRI and CAT scan. Now, for focused ultrasound treatment, because it uses the ultrasound technology to pass through the skull into the brain, there is a property in the skull that we would calculate. We call this the SDR. It's a number. So that's a calculation we do on our side once we get the CAT scan. Basically, it tells us how efficient your skull is for the ultrasound beam to pass through. So for some patients, the number is a little low. That basically tells us that we have to prescribe a higher dose of energy in order for the ultrasound beam to pass through. So if we find that, we would usually, give you a ring or arrange a consultation either over telemedicine or in person to discuss with you again. So we usually tell patients that, this is our calculation. We know or we expect that we have to give more energy, which means we expect patients to have more discomfort. Now, some patients would tell us that I still want to go ahead, I want to try, I have high pain threshold, we would go ahead and try. Now, again, during the procedure, you are fully awake, so at any point you want to stop the treatment, we could do that. On the other hand, there are patients who say, I have very low threshold for pain, I don't even want to try it. Then we can, talk about other options that are available for the treatment of tremor. And for all patients going through focused ultrasound treatment, they all undergo the same preoperative workup as any other surgical procedures. So again, on the day of procedure, it's outpatient. First thing we do is to shave the head. We put on the head frame, the same head frame that we use for focused ultrasound and DBS treatment. We do a wake testing, again, similar to DBS as well. Because the treatment is with the patient awake, there are some discomfort that they may feel. Pain, nausea, and giddiness are some of the most common ones. Post-operatively, the patients usually go home the same day. We give the patient some steroids treatment for the next 5 days or so. That is to treat the swelling that happens after the treatment. And at the same time, we tell patients to expect side effects. We tell all patients that after they go home, they may go home from the hospital feeling well, but over the next few days, they may start experiencing side effects. And again, these are the side effects such as tingling and numbness, gait imbalance, some speech difficulty or weakness, mild weakness, or incoordination that they may experience. So we usually tend to tell patients to be more aware after the treatment, take one step back, just make sure you are aware of your surroundings. And because we do that because some patients, they may not be expecting side effects after treatment because they are well on the first day. But we always tell patients that, we expect transient side effects that will come and then go away. So that's one reason why we tend to be more careful for patients who have baseline gait imbalance, because we don't want to tip them over during the recovery phase of the treatment. So at Penn, we've done a very high volume of focused ultrasound treatment. We are the first site in Pennsylvania to do this, started in 2017. Right, even before focused ultrasound was approved by the FDA, we have now done more than 550 cases. We are very interested in using the most advanced neuroimaging to help us with the planning, because we are almost obsessed at making sure that we are precise and we want to minimize side effects that patients have after this treatment. Because again, we know that there are side effects, there are transient side effects, but we take every effort to minimize this. And we are also very interested in using focused ultrasound in other indications, in exploring treating other indications. So how do we use advanced imaging for targeting? So this is some of the papers that were published by Dr. Halpern in his earlier days. So in this picture here is exactly where, in this cartoon, you can see this is the exact area that we know is involved in tremor control. We call this the VIM, nucleus of the thalamus. And on the right here is the high quality MRI that I've mentioned a few times that we use in targeting during the procedure. So we want to be as close to this area as possible and as precise as possible. So in the top right, you can see we use segmentations to try and identify this area as precisely as possible. And we've shared some of our techniques in how we do this with the community as well. So we also looked at whether our patients are satisfied with treatment after. You may receive a questionnaire after the treatment to share your experience so that we can improve the treatment for our subsequent patients. So you can see that most of the patients are very happy with the treatment. We ask them 3 questions. Are they satisfied? Did the treatment meet their expectations, and would they recommend the treatment to other people? And most of the patients express that they would recommend and they're satisfied with treatment. But we are also very interested in patients who are not. So we looked at why are patients not satisfied with treatment? And most of the time there are 2 reasons if they are not satisfied. One is if they did not have sufficient improvement in the tremor, or the second reason is they have long-lasting side effects. So you can see here, this bar chart here means for patients who are not satisfied, their side effects that they experience early on and long-term, meaning after 6 months, it did not improve. Whereas patients who were satisfied, the side effects that they experienced were short-term. In the long term, they all went away. So again, that knowledge helps us guide our decision in recommendation treatment. So again, how do you choose between deep brain stimulation and focused ultrasound? So again, there's a lot of discussion with patients preference, whether they want, they mind having a full head shave, or do they, or is there something that they are very concerned about? Do they just want minimal shave? Is the invasiveness a concern for them? Is the ability to tune the treatment a concern for them? Because again, DBS, we can tune it, we can adjust the stimulation that's being delivered. Whereas for focused ultrasounds, once the treatment is done, we cannot tune it. We do know that of all the motor symptoms, tremor appears to respond best with focused ultrasound. So if patients have only tremor symptoms, this is referring to Parkinson's disease, because essential tremor, all patients have tremor. We know that we are able to treat tremor best with focused ultrasound. For patients who are looking to treat both sides at the same time, and focused ultrasound is not an option today, because again, we have to space out the 2 sides treatment for focused ultrasound. And again, because of the concern of side effects, baseline function of patients, one of the most important consideration we have. So if patients come in already with gait difficulty, we may recommend not to go ahead with focused ultrasound. But again, that's a discussion we have with all patients in clinic. So I will show one of to end off one of the videos that we have for our patients treated here at Penn. This is available on YouTube.
That's the tremor in my hand. I actually have, it's not so bad in my right hand. It's just mostly, it's all in my left hand. And then I can feel, I can try to stop it, but it just wants to keep going.
Jump ahead so you can see how the treatment is done.
Dyskinesias and stiffness and slowness associated with Parkinson's.
We are able to do this with a patient who is awake and comfortable in an MRI scanner with real-time imaging. The patient will feel relief immediately, and the patient will go home the same day.
Here's the head shape, and we put on the...
We can apply low levels of focused ultrasound to the thalamus. watch the temperature increase using the MRI technology that's called MRI thermometry. And as we apply these little bits of energy to the thalamus, we can see responses in the tremor. We're going to do our first ablation. And we track those responses by having the patient draw spirals or reach out and hold their hand out.
Can you bring your arm up for me? Bring your arm up. Show me that tremor. Now what we're going to do is create a lesion in the area we've been targeting by going above 55 degrees. So the orange lesion is our target, which we've planned. And you can see that white area around it is the lesion that we've actually created. So we're going to do our last ablation and then be done. All right, that looks very good. I'm happy with that result. How you feeling?
Much better.
Yeah. Yeah, you got it. Yeah. What do you think? Look at touch my finger here and touch your nose. Over here. I'd say that's pretty good for day one. I'm just gonna check your strength here. Squeeze my fingers, squeeze, squeeze, squeeze. Pull me towards you. Good, super strong, excellent. All right, just relax. I'm glad that you're doing well. We were able to get you through this, okay?
Thanks, Doc.
You're very welcome. The effects of focused ultrasound are quite durable. We have data out at 5 years. It shows that 80% of patients continue to have significant control of their tremor. While this therapy is...
So all our treatment are currently done here at Pennsylvania Hospital, as mentioned. But we do see patients down at Lancaster, Dr. Cahigas, myself at Radnor. Dr. Halpin sees patient at Cherry Hill and Princeton as well. So we try to be more available for patients and see them wherever it's convenient for them. So I think, did I stop share?
Yes, thank you, Dr. Q. There are 2 questions here for you. Is whether someone lives alone and has caregiver support a consideration when choosing between DBS and focused ultrasound?
So, well, usually in the recovery phase, we encourage patients to have caregivers with them, especially, the first few days or first week or so after treatment, because we tell them, after all, they have a brain procedure, they need to be more careful. So especially, I would say for patients who are staying alone, we tend to tell them to arrange for somebody with them in the initial period during the recovery, whether it's focused ultrasound or deep brain stimulation.
And does the focused ultrasound help head or torso tremors, or mostly just hands?
So for head and vocal tremors, because it's a midline tremor, the traditional thinking is that for midline tremors, you need to treat both sides of the body. And as I mentioned earlier, for focused ultrasound, for now, we can only treat one side of the body at a time. We tend not to promise that the head tremor or vocal tremor will get better. In fact, we don't aim to improve the head or vocal tremor with focused ultrasound treatment. However, we have had patients come back to tell us that with one side treatment, it did improve. It does not eliminate the head or vocal tremor, but there's some improvement. But again, the traditional thinking is that for central or midline tremors, you need to treat both sides of the body. So deep brain stimulation might be better for that.
Great, thank you, Dr. Q.